right away. We're saving a lot of money for the government. Because, for instance, when typhoon come, because we pay our clients when their house is devastated, we pay them right away. If there are lives lost, we pay them right away. And when the houses that are insured, the benefit are paid, then they can start building their makeshift houses. They can buy nails. They only need about 5,000 pesos up to 10,000 pesos to start their house again and build their livelihood. So many of our clients don't go anymore to the evacuation center, and this save a lot of money for the government. Actually, Governor Salceda, if you will be charging the government, isama mo na kami, maniningil na rin kami. Just to give you an idea, the Typhoon Yolanda alone, all told, we have spent about 150 million pesos in terms of life, in terms of our relief services, in terms of insurance claim for our clients for their houses. And this was paid right after the calamity, right after the typhoon. We were one of the first institutions that was able to come in Tacloban and Samar. We have our own CDRAP, our relief assistance program. So when there's calamity, we provide our clients with rice, family packs, and that will last them for about 3 to 5 days. This is our own fund, using our own microinsurance surplus. Right away, we call for a moratorium. When the clients are in calamity, right away, we don't collect loans. Right away, we help them build their houses. We help them in stress debriefing, especially the children and the women. So we don't do any more collection. Instead, we make a quick turnaround and provide what we call special calamity loan to rebuild their houses and to start giving livelihood project with very, very soft loan and also longer grace period. So this is the way we respond on our helping our clients. There are still many, but I will just wait after the panel has made their presentation because of limited time. I'd just like to point out that it's important when there is calamity, it's important that the clients, the poor ones, have their own microinsurance and you're able to respond to them right away. Thank you very much for listening.
Thank you very much, Dr. Adib. Our next presenter will make his presentation from a very different point of view. He's the Executive Director from the Asian Disaster Preparedness Center, this time with a regional perspective, Mr. Shane Wright.
Thank you. Pleasure to be here, ladies and gentlemen. I've been travelling the last few days and not getting a lot of sleep, so I'm a bit tired, so my speech might be a bit slurred. If you can laugh, it happens. It's a pleasure to be here, and thank you very much for the invitation. ADPC is a not-for-profit organisation and one of the oldest resource centres working in the area of disaster risk reduction in Asia, in disaster risk management, climate change adaptation, and of course, as I said, disaster risk reduction. We believe in promoting resilience through helping communities be safer and by observing disaster risk reduction in all development efforts. ADPC was established in partnership with 3 United Nations agencies in 1986 and working in development, also disaster early warning and disaster response, with a dominant focus in those days in training. Now, because of the onset of severe disasters in the 1990s, our work was expanded to include technical services, project implementation and technical advisory to governments within the region. 2 pioneering programs were the start of ADC's programs and the implementation of that work. And that's the Asian Disaster Management Program that started the urban focus on impacts and hazards such as earthquakes, typhoons and floods. We also work with Naga City on risk-sensitive land use planning, and with Dugu, Pan and Pasig, cities on urban disaster mitigation and preparedness. We have offices in a number of countries, head offices in Bangkok, Laos, Myanmar and Bangladesh, and we've started up program offices now also in Saudi Arabia and Pakistan. And if you think about the overlay of disaster risk reduction in other regions in the world, and then you think about the overlay of community conflict, you start to think about how things might start to work in other regions such as Pakistan and also in KPK in Northwest Passage and also in Afghanistan, and you start to get a concept of how difficult resilience might actually be in areas where there is actually conflict. We do work in disaster risk reduction and disaster risk management in Asia, and you know why. The numbers are up there. And as Ambassador Romulo said earlier, the Philippines is number 3 on what might be described as a hit parade, but it's also rising. And the brochure that's on your tables, there's a magnificent slide in there that actually has tracked the number of typhoons and storms that has come through this country. And that's not a slide I've actually seen before. It's a very powerful piece of information that certainly drives one to a resilient manifesto. And so what causes disasters? Well, disasters are not caused by hazards. Disasters are triggered by hazards which interact with poverty, poor health, limited education, about disaster risk management and poor governance arrangements and complacency. I've seen in my own country with bushfires where people are very resilient but live in communities, understand what bushfire brings, but every time you have a lag in fire in my country, the community relies more and more and more on government, and people become very complacent very, very quickly. ADPC recognises that countries in Asia and the Pacific face enormous challenges. The additional burden of climate change and its effects upon the environment, having to reduce poverty more effectively in order to reduce vulnerability to disasters, adopting sustainable development goals along with promoting economic growth, all in an environment where there is numerous competing interests and limited resources. We're all concerned about the actors in the Philippines to promote resilience in the face of hazards by the following. And you know, we're looking for people to improve the ways they anticipate things, manage risks from an all hazards perspective, not just climate change, and this has been discussed earlier. You have the principles of law in this country, and that is a very strong framework and launching pad from which to actually create achievement, and we've seen some of that here today. The ability to formulate policies, integrate disaster risk management, commentary about climate change and adaptation, encourage partnerships amongst local governments. But probably one of the most important things in your at-law principles is to raise awareness of rural communities and urban communities that they too have a role to play in their own resilience. And we've heard today on numerous occasions how important it is to actually get to the base of the community. And that's one of the things ADPC does. It actually works with governments at the national, regional, sub-levels and also the community. So the Philippines as a society has a very good framework upon which to build. The intentions are clear. We've heard from Honourable Governor Salgado today that the model of excellence actually exists. So you have to ask yourself, why isn't it implemented right across the entire country? The Philippines is one of our member countries, and the Vice Chairperson of our Board of Trustees is Ms. Corazon Alma de Leon, former Chairperson of the Civil Service Commission and former Secretary of the Social Work and Development. Through the years we've implemented many programs, and Gabby Iglesias is here and will be here for the next couple of days, as I will be, and we're happy to talk to people individually about those programs. And we do a lot of our work through science, systems and applications. And we help enhance capacities in the utilisation of science, system-based information, understanding risk, specifically to identify and assess disaster risk at different scales of analysis, systematise the use of data and information in decision-making processes, ensure that warning reaches everyone in the community, no matter how remote, and we've seen examples today again of applications in the use of mobile technology, and improve capacity of disaster risk management practitioners to effectively respond and include all members of society. We help strengthen systems for effective management of risk, especially at the subnational and local levels, as I said earlier, and help strengthen climate and disaster risk governance systems, capacities from national to community level. We improve capacities for emergency responders and preparedness at all levels, especially local government and community levels. And that's one of the things I've been taken with by ADPC. It is one of the most connected organisations that I've ever met. Having worked in government for many years in Australia, I can't think of an organisation that's more connected in government anywhere in the world. The tourism industry is learning from the experience of Typhoon Yolanda and Bohol earthquake, where it is important that people not only feel safe, they also know what to do to be safe. Life and tourism may be more fun in the Philippines, but as the slogan goes, but to sustain growth or prosperity to remain, we have to raise capacities on how to apply tools and risk reduction measures to assist in the development practice. Therefore, we assist countries to develop strategies for the inclusion of disaster risk reduction and climate change adaptation in national and local development plans and programs, and work towards improving the knowledge of local actors on safer development and practices at community level. ADPC is the Secretariat for the Regional Consultative Committee, and we work with a number of partners and countries, and they're represented up there on the board. The Secretariat meets annually to map out areas that should be addressed in the disaster risk reduction challenge throughout the region. Partnerships are the cornerstone of ADPC's goals and objectives. We nurture partnerships and networks with countries and communities, with development, financial and education institutions. In fact, yesterday I was in China developing a partnership arrangement with the Institute of Disaster Management and Reconstruction, and ADPC will work with China to support them in their disaster resilience strategies. They have a very strong focal point on reconstruction, and we believe that we can assist them with DRR. One of the things I'd like to finish on is that I take a lot of learnings from movies, and I watch movies for enjoyment and pleasure, but I also try and relate them back to my work. And there's a movie that I think is particularly poignant in the discussions that we're having today, and that is the movie about Margaret Thatcher's life, The Iron Lady. And I'm not going to embarrass people and ask them if they've seen it. I've seen it, so I'll describe it to you. At the end of this movie, Margaret Thatcher, former Prime Minister of the United Kingdom, sits on a bed and she suffers from dementia, in a gown, you know, one of those gowns that are always open at the back, you know, sits on a bed and talks to a doctor, and even though she has dementia, the doctor says to her, "Hello Margaret, how are you? Would you like a cup of tea?" And Margaret Thatcher gets very annoyed, very annoyed. And she responds by saying, "Oh, I suppose you're going to ask me if I would like a scone or a biscuit next. Why don't you do us both a favour and ask me what I think? Ask me what I think. Because if you ask me what I think, you and I can have an intellectual conversation about the challenges that everyone faces." One of the most important things that you're going to do in these 2 days is meet someone you haven't met before, put your hand in their hand, say hello, broaden your already extensive network, and ask them what they think. Thank you very much.
Thank you very much, Mr. Wright. And it's always nice to have a name like Mr. Wright because you're always right. The floor is now open for questions from the floor. And I would like to, well, we're a bit over time, so we are trying to, gauge how many people would like to ask questions. Can I have a show of hands, please? Who would like to ask questions? I have one gentleman over here. Okay, yes, sir, please. Do we have mics? Yes, go ahead. There's another one here.
My name is Ralph Diaz, previously from the UN, the UNICEF representative, now the head of the president of the UN Retirees Association in the Philippines. One of the things that has been discussed is about the health issue. Now, we have a big problem in the Philippines. The first thing is that 30%, 70% of the health workers work in private hospitals and clinics. And they serve 30% of the people. And the 30% who are in public hospitals serve 70% of the population. And the difference in salaries is about 5 times to 10 times more. So in areas like where these things are happening, a lot of the barangays, a lot of the municipalities are poor municipalities, and they cannot afford to pay salaries for these health workers. We need to talk with DOH, change the system. I think it's an unfair system that we have set up in this country.
Okay, thank you, sir. Would you like to react? Yes, sir. Okay.
I don't think my health workers are underpaid. In fact, they're paid better than the private, because private are subjected to the market. I am subjected to civil service rules, and therefore I have to comply with salary standardization law. And therefore, if you say 5 times more, probably my salaries are 5 times more than private. Now, with respect to the problem with private, because they're essentially market driven, they account for 30%. And probably you want us to buy up the 30%, but we're just there for them as how do you call it, like a duopoly type of, just to make us behave in government, because they provide benchmark, and at the same time they provide competitive dynamics to our behavior. Because right now it is really all demand driven. Like in Albay, virtually everybody has field health. And therefore, once you have field health, like I am able to retain, I have one of the highest doctor per capita, highest nurses per capita, med tech per capita. And the secret is simple. I enrolled everybody. And therefore, all the health facilities, the health institutions can pay more because they have automatic demand. In terms of, I'm not saying higher morbidity rates, but essentially in terms of catering to all the diseases previously not attended to. So it is really the secret. You can use a demand-driven approach to modernize the entire health system. At the same time, you have the dual or the duopoly right now, wherein government accounts for 67%, and they're paid. The problem, I think, with the private is that you have surplus of nurses. You have surplus of, and at the same time, they cannot pay as much as the national government or the local government in terms of pay. So, I don't know whether I've answered your question, except to probably provide more empirical inputs to the issue. But I think it can be looked into in a more systemic fashion rather than just ask the DOH to do something. We'll stop, I think we have to have moratorium on people going to nursing schools. That's for one. And I think that's the first 9 steps. First good step, because there's just too much supply bearing down on a very limited system. And you know, even the demand-driven, well anyway, I've been asking for the nickname of Manulet. How do they call you?
Manulet. That's right.
Hindi iba yung tawag sa'yo ni Gloria.
Tama.
David.
Kindly explain, Manulet means.
I just want to support what
Yes, Secretary.
what Joey has said. This phenomenon about no doctors or nurses in in rural areas. You know, I think that can be changed, and I think Joe has proven it. The public sector nurses are actually paid better. The doctors who work in hospitals, if they're salaried, are paid better. I'll give you an example. A resident in Medical City will get something like 18,000 pesos a month. A resident in PGH will get something like 35,000 pesos a month. So it's a myth that public sector pays less than than private. I think the issue is in many of the rural areas, you need more than just the financial incentive for people to stay. And I think Joey has actually showed us that if the local government can provide more than just a financial incentive, people are going to stay. And I think in many of the local governments, that's the problem. Because, for example, it's within the power of the mayor to salary the doctor, to salary the nurse. They have to implement it. Now, I'll be giving some perspective tomorrow, but I just want to say that it's a very interesting phenomenon now, because actually the resources are now in local government. During my time, when I was secretary and was the cabinet in the cabinet with Joey, or even before, because let me go back to the 1990s, because I was with DOH in the 1990s. It was all centralized. But during the time of Gloria, the budget of the DOH, which I had to manage over 4.5 years, was 10 billion per year. Now the budget of the DOH is over 100 billion per year.
Can I just add to that?
Yes, sir.
Yung experience namin sa CARD, we also had that problem before, wherein we lack doctors, nurses. But what we did 5 years ago, we started accrediting doctors. And because of our membership, we sort of promised to the doctors, stay in the community, we will ensure you that you will have a steady flow of income by sending all our clients. And that did it all. In Quezon alone, Quezon province, we were able to retain a number of doctors who wanted to go abroad but just stayed, because we found out the doctors were only looking for opportunities so that they can help. This is a partnership that we had, Ambassador Romulo, Professor Carilao, under our Zuellig Partnership Program. So it did well. In terms of nurses, we're actually also providing now CARD as a group because of our health demand from our clients. Because you see, health is an issue. Every increase in income, and if they have health problems, 40 to 60% of the increased income goes to health. So we address that. So we hire our own nurses now, and the nurses are just staying with us. Although our salary is not that too competitive, but many of them really want to stay, just make sure that they have a stable job. The only problem, Governor Salcedo, is PhilHealth. I envy you, sana manababayaran ka. Our problem in, well, I have many friends from PhilHealth, but still the concern is making sure that the payments are on time. This is a concern. And we're now changing the landscape. We actually have established our own clinics. We have our own doctors and nurses. And we're asking PhilHealth, why don't you accredit our clinics right there at the countryside? So these are the things that we're working with.
Thank you. Thank you, Doctor. Let's try to cover some more ground. Yes, sir. I think there was, you raised your hand earlier. Could we have the mic, please? And then after this gentleman, we'll take the question from the lady here, and maybe the last question will be from the gentleman in the blue shirt. Okay?
I am Ernesto Labonto. I am a member of the Filipino Inventor Society. I have 2 patents on water purification. One of the 2 patents is similar to what the governor has been using all over the provinces during disasters. I have my own design, which only consumes 6 kilowatt hours, and it can produce up to 100,000 liters per day. And this is mostly gravity fed. And the other one is a portable type, which will be shown on ang heret, I don't know when. I had my demonstration and presentation yesterday.
So do you have a question, sir?
Okay, my question is, what should we do with these inventions? We took a hard time in developing it. It took me 16 years for the portable type. Nawasa, which is a portable type which weighs only 13 kilograms, which can purify flat water into drinking water in minutes. So what should we gonna do with these inventions? In Yolanda, you use only 7 units, and in Bohol, only 4 units, and in calamity outbreak in Catanduan is cholera. Secretary Simpson got only 100. We need thousands of this. So, can somebody help me mass produce these units? These are something very useful, which people who don't have jobs can manufacture them so that they can earn a living, and then with that they can use on disasters.
Let's get a reaction from our panel. Would anyone like to react?
Ako ba?
Kasi
Kasi lang,
I can help, please.
natutuwa ako sa tanong kasi pag iniimbitahan ako dun sa China, kahit I think biglang yung conference pala, yung puro bentahan ng equipment. Oo, pero pang DRR. Siguro kailangan na sa hustong edad na tayo para magkaroon ng gano'n, ng DRR Technology Summit. Kung saan lahat na may pwedeng gamitin para sa disaster ay nandun. So Mon, I throw back the question to you. Can you please organize that for our it makes sense. Because in China, every time there is a conference on DRR, once you get out of the room, there's like a huge hall where all the equipment that can be bought and used, then bought. Nagbibentahan talaga. So ginagamit nila yung mga DRR conference na kaliwat kanan para magbenta ng equipment. At tingin ko kailangan gawin na rin natin.
Nabigyan pa ako ng trabaho. Any other comments? Okay, can we go to the lady over here on the right? Yes, ma'am.
Good evening to all of you. I would just like to say that the reason why, first I'm from the Diocese of Cubao, Vicariate of St. Joseph, San Isidro, Labrador Parish. All I would like to say is that there are few nurses in the government hospital, even if the salaries are high, because it is difficult to be accepted there. You need somebody to recommend you, somebody that, while in private hospitals, you can just apply, take the exam, interview, and if you pass, you can be accepted. In the government hospital, it's still very hard, up to now.
Okay.
Even if they like to work there because it pays more.
Maybe that's why kailangan ng recommendation nun, because it pays more.
Pero ako tingin, hindi naman kami lahat ganun, no? Alam mo, kahit isa, punta sa Albaya, ni isang rekomendado wala akong kinuha. Ni isang tao wala akong binit papasok. Ni isa, not one. Disiplina lang sa katawan. Kaya tingin ko naman, kaya maraming tao na yung nangyayari sa amin, na suportado ng tao. Hindi ako suportahan, pero ako mismo hindi may disiplina sa katawan. Pero ma'am, kaya ang gawin. Pero katulad ko, ilan ang job order ko ng nurses na halos lahat ng mga hospital doon, nilagyan ko na ng job order, ma-accommodate lang sila. So, yun ang sagot ko sa'yo.
Ernie, you have a comment.
I think Governor Salceda is an exception rather than with reference to it can be done, but not all are doing it. No? In our work with local governments, a lot of them get there not truly knowing what health is all about. And therefore, when they don't know what health is all about, obviously they will not pay attention to the system. if we address health resiliency, in other words, when you have a situation wherein how is the health system able to respond or come back right away to be able to meet the health needs of the people post disaster, you really need the tandem of the governor and the mayors, because the governors address the whole issue of hospitals, you know, and that the local mayors address the whole system of primary health care. In his particular case, not only did he address the hospitals, because when you take a look at the data, I think half of the deaths are now happening in hospitals. They're now migrating to the hospitals, and that he looks at he looks at the health situation of the different municipalities, and those municipalities that are not doing well in terms of health indicators, he sits down with them and addresses what has to be done in reference to that. Binibigyan ng bagong hospital, or he provides a fund. Not many governors do that. Not many governors do that. That's why you may have the resources. In other words, whereas before the problem was resources, now it's no longer a problem. It's just a question of how do you now allocate, how do you now tweak the system to make it more effective and make it more resilient. I think that's the challenge there.
Okay, the second to the last question will come from the gentleman in blue shirt. You raised your hand earlier? Yes, sir. No, I will abuse my position, Douglas. I will ask the last question.
Hello?
Yes, sir.
Yes. This question is for yes. This question is for Mimura Sensei and Konishi-san. I am Paolo Menjoro from the University of Asia and the Pacific. If you saw what happened during the relief operations of Yolanda, you saw probably if you saw from the news and from social media that it's very chaotic. And then when I saw the media coverage of the relief efforts in Japan during the earthquake, it was very much very organized. Okay, and then during these relief operations, the Filipino people would try to back it up with empty rhetoric like the Filipino spirit is waterproof, while in Leyte and in Tacloban, people are dying over there. And then you see Japan a little bit, actually much better looking. So I think that the Filipinos' concept of the word resilience is still not what I would call mature compared to what I can see from the Japanese perspective. Sensei, what do you think?
That's an undiplomatic question.
Thank you very much for the tough question. And as you know, at this moment, one big typhoon is approaching to Japan, and actually it hit the southmost part of island yesterday. And they said the news reported that there are no people killed, and just a few people are injured. It is because Japan is very, very resilient. But yes, Japan is resilient for disasters, but it's mainly because of the structures. We have very strong structures like breakwaters and the banks, and building code is very strict. But when I look back to Fukushima case, along the coast of Fukushima was washed out by tsunami, but due to the fear for radiation, the rescue work along the coast of Fukushima was difficult, and many people were abandoned. So Oh yes, Japan resilience of Japan is advanced, but still there are so many challenges for us also.
Huwag naman tayo masyadong manos sa kiki natin. Eh, 7,000 lang namatay sa atin. Kung kwentahin mo, dapat mga 30,000. Kung meron kayong necro-scientific approach to this issue. But you know, iba-iba talaga ang Japan. 72% ng kanilang pera nasa local government. Kung sino marunong, humarap dun. Eh, bigyan nyo sa amin yan. 72% of the entire budget of Japan is lodged with the prefecture, right? Yes, it is in the prefecture. So you would have the Fukushima prefecture would have the financial resources over a long period of time. Yes. Yes, I am there, so I'm looking at you. Okay. Napagalitan to niya ako. 72% of the money of the public resources in Japan are lodged with the local government, who are there, who would know what to do. And that's not the case in the Philippines. Only 18% of your budget is lodged with the local government. Now, who's looking for resiliency? Resiliency of the national government? They're not there. They will not be there to save me. That's virtually a prejudicial issue about resiliency in this country. It's the way we manage ourselves. You know, Filipinos are so good, you will die for them. It's the Philippines you cannot. Because you're genetically designed. Is there a media here?
Yes.
Filipinos are worth dying for, but really, the way we manage, we organize ourselves as a people, we gotta work it out. But you have a very positive guy. At the center of it all, of resiliency, I'll tell you what is the name. Trust. Trust. Institutions, trust in institutions. You build trust in institutions, you build resiliency. No trust, no resiliency. Because trust mobilizes people's support, people's participation, external resource mobilization. So, para sa akin po, in the meantime na wala tayong resiliency, wala tayong gano'n na mga institutional arrangements that benefit resiliency, I think you gotta pick all these people. Ilang pinili mo? 10? You're picking 10 to replicate Albay?
More.
Oh, see, put more money where your mouth is.
Yes, sir. Kunisi-san, I think you want to comment.
I just want to, even Japan is still going through learning process compared to what happened in Fukushima. That was a lot better than what happened in Kobe. And it is a learning experience, process. That's one. Second is the presentation that Governor gave is basically a textbook on how you build resiliency. And I'm going to take that back to my disaster risk management team to start analyzing this. And in fact, if we can replicate what he's doing in Albay, you will have much less problems. Right? You have a great example here, right? But it is all about, right, building infrastructure that is resilient. You have information and education process that educates the population, right? And you have a financing plan for the local entrepreneurs, households, local governments, and national governments. And it takes a lot of money to build resiliency. And Japan has spent years building it up. And so the financing aspect of it. And did you know, most of the provinces, all of the provinces, already has automatic contracts with contractors. So as soon as a disaster hits, they're mobilizing to remove
to start. That type of experience, that type of knowledge comes from experience, and that didn't exist 10, 15 years ago. So it's a building process, and that's why it's great to be having this particular conference, because we're learning from it. Thank you.
Thank you very much. Ladies and gentlemen, I know we've gone over time, but before anything else, let me first of all recognize this panel. I think you know a little more about resiliency, and I hope you'll come back tomorrow so that we can finalize our final objective to generate resiliency as Governor Salceda has done in his province. Last point, before I acknowledge some people here, I did not realize that my staff organized this meeting for the campaign of Governor Salceda. For whatever post, perhaps the highest, because he said he's done a hell of a lot. I want to thank you, Governor, for being here. And the media has just picked this up, so you're in deep trouble. Ladies and gentlemen, a lot of this would not have happened except for a lot of people that are here who have supported this. First of all, the principal of my foundation, the Zuellig Family Foundation. I want to recognize Daniel Zuellig, who is sitting here. And then the organizing committee here, of which I am part of, and the one who has been a treasure of wisdom and will help the Philippines even more, Tony Yulo Loizaga. The other one, who doesn't like to be recognized as the husband of somebody, but who is in his own capability really proven himself as one who has helped us tremendously, Dr. Eric Lacanlali. And Ernie Garilao, who's here, you'll hear more from him tomorrow. But I think, first of all, I thank all of you, because this has been a very interesting session. And for those who haven't had a snack, their cocktails are being served now. Thank you very much indeed.